Hi, I'm Dr. Thomas. I just wanted to take some time to share with you what we do here at Allied Healthcare Clinic, the home of the running doctor. We do quite a bit for lots of different types of athletes that come in. We have basketball players, runners, cyclists, football players and soccer players, and each one of them have their characteristic injuries that we take care of.
I started coming to the running doctor at the end of last fall's triathlon season, and unfortunately I came a little too late for tri-season, but the good news is coming into next year I feel really good about it, and I feel like I'm going to be a lot stronger because of my rehabilitative program with Dr. Thomas. Unfortunately, I did develop an injury, and it was because of my muscles just becoming really tight, and I tried to use traditional stretching. I used heat and ice, and I tried to do a lot of things on my own because I thought I could stretch it out and I thought I could work it out. I really didn't know what was going on. I just knew that my running stride had shortened, and that I wasn't running and performing at the level that I knew I should be capable of. And so I called Dr. Thomas and looked up the running doctor, and I talked with them on the phone, and they invited me in and said that they could help, and thank goodness I did. He came in and he looked at my whole body and not just at where the injury was, and that was something that was very educational for me, and as part of someone who's very active, I like that knowledge and I liked learning, and so we looked at, you know, my whole body, and I was actually treated from the whole body perspective and not just an injury perspective. And so he encouraged me to continue running, and I did, and I ran through while I was being treated, and I noticed that the results were happening, and the muscle soreness and tightness was going away, but I was also learning and gaining from Dr. Thomas how to stretch moving forward. And so I incorporated that into my workouts, and after runs or bike workouts now, I do these certain stretches, and I really think about my core, and I think about my technique and my form a whole lot more, and that's really due to Dr. Thomas. Otherwise, I think I'd still just be pounding it out there and probably not getting the results that I want to get. And the true test is that also, you know, my daily job, like I said, I'm very active, and then being able to play with my children, work in my yard, and do those things in addition to sports and activities that I love, and just really feed my passion for triathlon. Now moving forward into this 2011 tri-season, I've already looked at my races. I know what I have coming up, and I know that it's time to get back in with Dr. Thomas and start the prevention work. And I'm really looking forward to that because I think this is going to be a better season. I think I'm going to get the results that I want to get. And I've learned that it's not all about, you know, the workout. You've got to do taking the whole body into perspective and the whole plan into perspective, and work that plan fully in order to get the results and accomplish the goals that you've set out for yourself.
We do a lot of soft tissue management to help to alleviate the problems that can arise with various sports injuries for those joints, such as the knee joint problems, the ankle joint or shoulder joint problems. In addition, we have a wonderful protocol that I call Dr. Thomas's 4-step muscle stripping protocol. And that protocol targets the muscle that controls or moves the joint. It's a very good protocol, a good process to rid the muscle of adhesions and prepare the muscle for the activity of that particular sport that the patient is involved with. We also do chiropractic. We specialize in sports chiropractic and pediatric chiropractic, and we see a lot of elderly patients as well. Chiropractic is a wonderful method of making sure that the nervous system is controlling things in the body the way it should 100% of the time. If there's any kind of interference to the nervous system from either tight muscles or misaligned vertebrae in the spine, then that can interfere with the flow of information from the brain controlling the various areas in the body. And so, in essence, chiropractors, we are very interested in that relationship between the nervous system, the musculoskeletal system, and the relationship as far as the biomechanics go with the pelvis, the biomechanics of the spine, the biomechanics of your extremities, the joints in your extremities. If all of these areas are moving properly and functioning properly, then things will work out very well for the patient. We're always wanting to make sure that all of these areas are being addressed.
I'm referring all my athletic friends to Dr. Thomas, not only for his stripping, not only for his expertise, but his ability to be able to relate to an athlete also. And I think most doctors, they're just doctors. We have a running doctor. We have a physical doctor that knows how it feels to train and knows what it does. So again, the muscle stripping, the nutrition, the biofreeze, the vitamins. I mean, he is a well-rounded doctor, and I am very thankful to be in his practice.
One of the other things we do is foot scans for all of our patients. Your feet are the foundation of everything. If your feet are flat, if they have high arches, then that's certainly going to affect your center of gravity, which is the pelvis. So we do a foot scan on everyone to make sure that the foundation is there. If you are missing any of the 3 arches of the foot, if any one of those arches have collapsed to any degree, you're typically going to have a rotational effect take place in the lower extremity that will affect the fibia, tibia, and the femur, creating a dropped pelvis. And that center of gravity, your pelvis, is critical in making sure that everything above the pelvis related to the spine is in its proper alignment. If that pelvis is off, going in either a clockwise or counterclockwise direction, or a forward tilt or back tilt presentation, it will certainly affect your spine and even your shoulders. So we want to make sure that everything is intact, and we always look at everything from a full body perspective to make sure that you are functioning at 100% of the time. And so we pride ourselves with that. We have a nutritional aspect of our practice that involves sports nutrition, pediatric nutrition, a detox program, and a weight loss program. Our most popular nutritional protocol happens to be the detox program.
Hey, my name is Stephanie. I'm here to see Dr. Thomas because my back is jacked up. I'm an Operation Boot Camp instructor, but I'm also a long distance runner, and I kind of overdid it in December. I've had ongoing back problems for the last 4 years, but it actually brought me to a halt at the end of December. So I decided to come see Dr. Thomas. I'm in the middle of my treatment, but I've already seen great improvement, and I'm grateful for that. Unfortunately, I'm still not able to participate in my normal activities of running and exercising, but I anticipate that I will be back out there very soon. Dr. Thomas is great. He's made an incredible difference for me emotionally as well as physically. And I would encourage anybody that struggles with back issues to come to his facility and seek guidance and treatment.
One of the other things that we have in our practice is the Accuspina IDD therapy. It is incredible. We have helped so many patients with this therapy. It really does cause an emotional response for me. Patients have been faced with surgery. They have been inundated with just massive amounts of medication, the muscle relaxers, the pain pills, the corticosteroid injections. All of these things, they simply do not work. All they do is mask the symptoms. Our patients know that all so well, and so when they come to us, they're ready for something new, something different, something that they hope will work. And that tends to be, in many of those situations, the spinal decompression. That usually is the answer. Many of our patients, they are referred to us by orthopedic doctors and neurologists who don't know what else to do. They've given them the muscle relaxers, the pain pills, the corticosteroid injections, epidurals, the pain patches, the pain pumps. They've tried the physical therapy. They've even tried chiropractic. I'm here to tell you that none of that stuff will work to solve the disc issue. If the disc is herniated or bulgy, you have to fix that. And that's what spinal decompression does for our patients. And so we have that wonderful service also to offer for our patients, and many of them, they walk away from here just with their lives just virtually changed forever. For our spinal decompression patients, we also do the soft tissue management for them. Some of them we can actually adjust while we're treating. It just really depends on the nature of the injury and how severe their situation is. Many of our patients come in needing an MRI. We do MRI referrals. I also do second opinions. So if you have an MRI and you're just uncertain of what it is that's going on with that MRI, or no doctor has ever took the time out to explain that MRI for you, I take the time. I take the time with all of my patients who have MRIs. We sit down, we go over the MRI detail by detail. We show models if necessary to get a good, clear understanding of what exactly is going on. And if I can help, I help. If I can't, I refer it out to whatever specialist is indicated for that situation. So we get down to business here. We really love what we do. I love my patients. I love my practice. I love my staff. We love you. We want to help you. So please, if you're suffering, or if you know anyone else in your family or friends that are suffering needlessly and they've been through the ringer with medications, or they may be even facing surgery, send them over here. Send them over here. Let me see if I can help them. Let me sit down with them and explain our protocols and explain what it is that they may have in regards to questions. I'll do my best. I will do my best. And if, like I said, if I can't help, I will send them to someone that can.
My name is Sarah Ingram. I'm 65 years old, and I have been coming to Dr. Thomas because I had a problem with sciatica. At first he treated me with muscle stripping and the usual stent and heat, but that wasn't working after a couple of weeks, so he decided that I should have an MRI. I had the MRI, and he was surprised to find that I had 4 discs that needed treatment. He said that he probably could help me if we did the IDD treatment. And since I was eager to get back to the gym, because I've been going to the gym for about 3 years, for about 5 days a week, and I wanted to get back to the gym, so I said, sure, let's try it. In addition to the IDD treatment, we have been doing some muscle stripping. And I asked Dr. Thomas what it was for, and he said it's to get rid of adhesions and to get my muscles ready to go back to the gym. I want to do a lot more walking, but I'm going to do it at the pace that he says that will improve my, my discs.
Feel free to give me a call at 770-460-1911. I will personally sit down with you in a consultation, give you that second opinion, go over the MRI, whatever it is we need to do. I'll answer your questions, and we'll get to the bottom of why you're suffering and get you out of pain. I want you to live a pain-free life. That's my goal. I want you to live pain-free. So please, give us a call. Don't wait anymore. Don't suffer anymore. I know you're sick and tired already of being sick and tired. So let's do something about it. Pick up the phone, call us, 770-460-1911. Thank you so much for your time, and please share the word. Remember, sharing is caring. Thank you.